Hi everyone, my name is Devin and I currently work in a behavioral hospital in Las Vegas for children 6 to 17 years old. I've been a registered nurse now for the past 4 years, and my nursing background includes working in med-surg and 2 years of working currently now in a behavioral psych unit. In addition, I am a retired veteran, 21 years of service, and 8 of those years I've been a medic in the military. I'm currently pursuing the psychiatric mental health nurse practitioner program at Post University. Reason being, I want to work with veterans one day at the VA, as I can relate to the mental issues they go through being downrange. A common complaint seen in the primary care is knee pain, and a typical scenario would look like this. A 35-year-old male presents to the clinic with complaints of left knee pain for the last week. Onset: the pain began gradually about 2 weeks ago. Location: the pain is located on the outer portion of the left knee below the kneecap. Duration: it's intermittent pain. Characteristic: the patient described the pain as an aching pain. Aggravating factors: the pain worsens when running. Relieving factors: rest and ice and taking over-the-counter pain medications. Timing: the pain commonly occurs early in the morning when awakening and especially when jogging. Severity: the patient relates the pain as a 6, and on its worst days, it's a 10. Because the patient's chief complaint is they're experiencing left knee pain, I would perform a focused examination on the patient's left knee. The first thing I would do is complete an inspection looking for whether there's any swelling, erythema, deformity, or gait abnormalities. After that, I would palpate the patient to check for tenderness, warmth, effusion, and crepitus. Next, a neurovascular assessment will be performed, which will include the distal pulses, capillary refill sensation, and motor function. I would also evaluate the active and passive range of motion as well as the strength of the muscles. The underlying cause of pain can be determined with the assistance of specialized tests, such as the Lachman test for injuries to interosseous ligament or ACL, and the McMurray test for injuries to the meniscus.